Hello, everyone. This is now Dr. Isatu Kakay-Diallo. I know I can't to you today live because, and I wear the mask just so that people could say, what is all that for? What is the mask for? As we all know, we're in the pandemic, and I hope say everybody did do well in the pandemic. For the one that they listen to me, they follow me in Sarah Network, no say they always talk about COVID-19. The mask definitely gets a meaning as to why, but I just feel say as they always educate people them, as they always talk to people about COVID-19 measures, how to protect yourself, and take the vaccine. I believe in the vaccine. I feel say it makes sense. Something go wrong with me, where they preach to people them, where they talk to people them about their health, I will come back and just talk about what's really they going with me right now. So just so that everybody know, the title say fully vaccinated and tested positive for COVID-19, with symptoms. So if they watch, they really see, you can already see the symptoms starting with my right eye. My symptoms, I started getting symptoms on Saturday. Saturday was just like some form of cold, like saying a cold I get, or a little scratchy throat, and I thought it's just gonna go away, right? Like thinking, oh, okay, the kids started school, I'm gonna, get a cold and it's gonna go away. But even though I did a program on Sunday, I was sick, but I wasn't that bad. It actually got worse on Monday. It got worse Monday night, runny nose, nasal congestion, and that's pretty much it. And with slight headache. I woke up yesterday, went to work with the hope that I'll get through the day, which I couldn't. I got to work, more tears, my eyes become more red, the eyelid was more swollen than it is right now. And so one thing I remembered when I took the COVID-19 vaccine was I had pain, like muscle pain or rib pain, right? Which, if you've listened to me, I've mentioned my own symptoms that I had at that time. So I experienced that just like, by coughing one time, and I felt that pain. I said, no, this doesn't make sense. Before I leave, I had already said I'm leaving work, I'm going home. So I decided to get tested yesterday, around 11 in the morning, American time. And then now I decided, I came home, got home, took a shower, tried to take some nap. And when I woke up, the first thing I wanted to check was my results, because I checked on my chart. I logged in, and I've been doing COVID-19 tests for the longest. I've never tested positive. This is the first time I tested positive. Even the antibodies, the blood draws, never came back with any build-up immunity. And I did got my first dose of COVID-19 vaccine in December on the 24th. And I got the second one after my trip to Freetown. I came back and I did the second one, in January. And it's been negative ever since. Even when in June, I also came back from Sierra Leone. I decided to get tested again before you get tested. And all these been negative, right? But this is my first positive COVID test. I'm currently home on a quarantine. I think the first question, I believe, would be, why this? Why tell people what's going on with you? I think why tell people what's going on with me, because I know COVID-19 is real. Sometimes people think COVID is not real. Even with vaccination, I have got a positive test of COVID-19. And mine is not just like I'm walking around with no symptoms. I had symptoms. Nasal congestion, runny nose, a slight headache, muscle ache and pain. That makes you wonder. And you can see I decided not to wear makeup. Why I don't wear makeup? So you could really see that this person, she's sick, right? She's going through something. And my day has been trying to coordinate so many different things, which is first make sure my kids go get tested. They have all gone tested. And the good thing, everybody is in a separate room. And also we would not share, the same, bathroom. We would try to avoid, contact as much as we can. And of course, I will be wearing mask even though I'm in my own room. And continue to do all the different things that are being recommended, hand washing, which I believe nobody tells me things like that. I actually tell people about that, and I get paranoid with that. But just so we all know, COVID is real. No matter how much precaution you take, it's still there. But the good news, there is a good news. And what is that good news? The good news is the symptom that I'm exhibiting right now is much less compared to somebody who had not taken a COVID-19 vaccine and who has not been adhering to COVID-19 measures. So if you know, I talk about the symptoms. Not long ago, I did a health talk, which is on the YouTube page. It's also on the Facebook page about COVID-19 booster, the third dose, and I've been talking about it throughout the radio platform or radio program when I talk as a panelist. I would advise people that there was a time, Pfizer came out saying people going to need a booster dose after 6 to 12 months. I think mine just is around that time, saying now, hopefully they would consider me to get a booster dose. I know I'm not there yet. They have to give those people that have immunocompromised conditions. So with that, I am home resting, getting supportive care, hydration, but I just want, those that listen to my health topic, those that listen to me on the radio, know that this is what's going on with me today. So I am day 4 with the symptom, but I would tell you this. Yesterday, if I was a 10 in terms of grading how bad my symptoms were yesterday, today is a 5 or 6. That's how much improvement it's been. And that's to tell me that the vaccine I took was helpful, was effective. It's just that maybe something somehow made me to contract the virus, right? If you know, I work in a hospital. I come in contact with patients. I do wear masks, my full PPE. I do wear that. But one thing I changed from last year, how the pandemic was much greater, worse with symptoms, with diseases, would be that I don't wear double mask. I would wear surgical mask. But that again should not only be the reason. But I look at my eye and I say to myself, why would I get a swollen eyelid? Why would I get red eyes, like this, right? And we all know, how do you get the virus into your body? Either through your mouth, your nose, or your eyes, because these are openings that have fluids. So could be one of that. And it's so many things happened last week. Flooding in New York, rain, who knows what debris got to my eye. I wouldn't 100% say that's the cause, but I'm just trying to relate and analyze the entire thing that happened. And my hope and prayer is that my entire family that got tested today come back negative. So The kids can go back to school, and this problem would not hold them up to stay, which they're going to be quarantined, just so everybody know. The good thing, my husband is vaccinated, fully vaccinated. My daughter, who's 13, she's fully vaccinated, and I am. So we only have 2 of them, who's not fully vaccinated because they're not the age. I have an 8 and an 11. So until they are 12, they cannot get vaccines. But I believe in vaccination. I believe that the vaccine is what's helping me right now with my symptoms. Because if I had not taken the vaccine, I'll probably be much sicker. That's one. And the other thing is, I always talk about even the flu vaccine. I said, your symptoms with somebody that took the vaccine and somebody who did not take the vaccine would be different, right? It would be different because you took something to protect yourself. Even if it's 50, 60, 70%, I got that. And I am grateful for that. So I really do continue to urge people to be vaccinated because it could be worse. It could be worse, right? So as I stay here to talk about all this, I still want people to know the symptoms might vary, meaning it will be different. For me, it will be different for you. Because I had no fever. I had no fever, and my temperature that I just checked was 98.6 degrees Fahrenheit. That's just so, I didn't have no fever. The one thing, I had a runny nose, nasal congestion, took remedies that would help me go to sleep and all that. But woke up, it was bad. But when I got to work, it got even worse. So I just needed to come home, and which I did. And I believe I did the right thing to get tested, not to think, oh, it's just cold, it's going to go away. I'm fully vaccinated, I'm not going to get COVID. That's a myth we should not think about. That's something we should say to ourselves. Even though I'm vaccinated, I can still be positive. But not everybody. But I'll tell you, we have very small proportion of individuals who are fully vaccinated will get test positive for COVID, right? So I happen to fall among those people, among those percentage. But what can I do to ensure that other people don't fall into the same category? Is to educate them on vaccination, is to educate them on COVID-19 guidelines, measures, so that they can protect themselves from severe illness, as we already know that the variant we have out there right now is much contagious than the ones we had, right? So if somebody's going to ask me what type of variant I had, I wouldn't be able to tell you that today. But I would definitely, want to know, right? Hopefully they're going to reach out to me, actually, right? At work, they will. So that's just for people to understand that if you don't get vaccinated, your symptoms are worse. If you get vaccinated, your symptoms are milder. And remember, my last dose of vaccine was January. And this is what, 8 months down the lane? What do you think is happening? That booster dose is needed. It's needed. And that's what I emphasized during my last health talk. And I would encourage you to do that. And please, please continue to do everything you can to protect yourself, protect your loved ones, your community, and the world. And how can we really combat COVID-19? Everybody have to do their own part. What I'm doing, talking to people, is my own way of educating the public. That's part of my job. Public education, public health education, right? As well as preventing disease by getting vaccinated, encouraging my patients to be vaccinated. I think that I'm doing what I think I can do to help in the pandemic era, and I hope you do the same thing. But I thank each and everyone that listening to me right now, that COVID is real. Be vaccinated. If you're eligible for booster dose, go ahead and take it. Continue to wash your hands, mask wearing, social distance, and the difference would be less severe illness for being vaccinated. And I think that's what I'm gonna be here saying. I'm grateful that I did that. I made that decision, and I'm grateful to the Almighty Allah as well. I do want to say thank you to all my friends, family, all the ones that have reached out to me earlier, because I did send out a message to people that I know that would want to know what's going on with me. I want to say thank you to everybody, and all those of you right now listening to me, thank you. Thank you, thank you. But I will definitely update you, because I'm going to be home for 10 days. They're counting today as my 4th day of being exposed, because that's when you are like highly contagious. So hopefully they will let me go to work next week, but if not, I'll be back home. But I will keep in touch. I will come back and talk to you and let you know where things are with me. I hope everybody stays safe and take care. This is Dr. Isatu Kakay. Thank you. Thank you all for the best wishes. Momo, Rosalind, and Maju, I thank you all. And all those that are also watching. Thank you.